involved in a movement, a health movement, concerning females. And it is very serious because, studies have shown that women come in contact with these various sanitary products between 15 and 16,000 times during their lifespan. Now, a lot of them don't have any effect, but some of them do. And when you do, it can be very, very serious. As Catherine mentioned, I mean, cancers of all types, cervical cancers, ovarian cancer, ovarian cysts, thyroid tumors, breast cancer. All these things have been found to be produced by the feminine products that women are using these days. I mean, there are chemicals in these products that are proven cancerous. I mean, you got things like odor neutralizers, artificial flavor, polyester, adhesive, polyurethane. And these chemicals that are leaking into your system over time, they produce some pretty heavy illnesses. I mean, as Catherine mentioned, hormone disruption, birth defects, dryness, and a lot of this is because of the materials that these products are made of. I mean, a lot of them are made of recycled paper. And a lot of that recycled paper has print ink in it. So, and what they do is they bleach this with chemicals, and chemicals like dioxin and chlorine. All of these things lead to some of these horrible effects on the woman's body. So, there's a movement out that encompasses a better way to do it, a better way to get the results you need during their female cycle, and do it in a more healthy way. It's an organic pad, completely natural. One of the things that you'll find, if you take and tear apart one of those napkins, there's plastic in there, which prevents airflow, so that once it's on your body, once it's in use, studies show from the World Health Organization that within 2 hours of that use of a typical pad, about 107 different germs develop per cubic centimeter on the surface of that pad. Now, when that happens and there's no airflow, these germs do what? They come in contact with the heat from the blood, and since the materials they use don't really do the job of absorption, they backflow into your system. Harmful, ladies. Very, very harmful. The organization that I'm involved with is called Nspire. It's a movement. And Nspire, Nspire is hasn't actually, the product hasn't actually launched yet. It won't launch until March the 1st of this year. But this is a great time to bring this attention to this to those ladies and females in your family that you love and you want to protect, and save from having any type of possibility of succumbing to one of these illnesses. So it's there's information available, and Cass, you can play that video at this time. That would be good.
Okay, great. Give me just a second to find it here. I gotta make sure it's pulled up. Keep talking for a minute. I got to figure it out.
Okay. Well, the thing that I think is most important is awareness. And once you're aware of the problem, then you have an option to do something about it with Nspire, and to most certainly spread the word. Tell the people. Tell your sisters and your grandchildren and your nieces and all the females in your family and those that you know that they stand the risk of contracting one of these illnesses through the products that they use on a monthly basis. Again, 15 to 16,000 times a woman comes in contact with these products. And there are numerous studies that have found that a lot of these cancers that women are suffering from come from these products. Okay, here we go.
There we go. All right. Hopefully you can hear this. Leilani, I can see you, so if you can give me a thumbs up or an okay sign if you can hear it all right. Whoops, sorry. I was trying to stop it. So it's been really frustrating for me for them to be using, let me stop sharing screen here and get back. Let me figure out how to get back. All right. It's been really frustrating for me to learn that they're using this medical device law to get out of telling us what's in tampons and things. Like, I had no idea that tampons and pads were considered medical devices, but this is the same way that they're getting away with the mesh injuries. The mesh that they're putting in us is also considered a medical device, and they don't have to tell us that it's made out of all these materials that make women extremely sick and ruins their lives. I have so many friends that have mesh injuries, and they're getting away with it because of this medical device law. And then I find out that that's what they're using with these tampons. So I'm going to be on a soapbox on that medical device law, I can tell you. Come on out and share some more with us, Larry.
Well, you know, Kat, the thing that's most troubling to me is the fact that, as you said, these laws, they're manufacturers of tampons and pads are hiding behind these laws, and the public is just unaware. Our people perish for lack of knowledge. So, you need to spread the word. Nspire will launch these products on March the 1st. Between myself and Catherine, we will have all the information. So if you need, Catherine can give you my contact information, and we can get any of your questions answered between now and then. And you need to get as many of your relatives and friends, female acquaintances, aware of what's going on and what the potential downfalls or illnesses of these products may cause them. My ex-wife had a double mastectomy. Now, they don't know where the cancer came from. I mean, and I'm not saying that it absolutely came from the products she was using, but who wants to risk that? Do you want to see like your nieces or your grandbabies having to go through that type of situation if they don't have to? I don't, and I don't want to see anybody else's loved one go through that type of ordeal. So, stay in touch with Catherine. Alert your relatives. It's very, very serious, and it's very important. We have, you have the knowledge, or at least part of it. So, it's time to step up and raise your voice. Tell the people. Here's what I see happening. Manufacturers know what's in these products. They're not telling you. The medical community is not telling you. They know too. So it's up to the individual to arm themselves with the correct knowledge to save lives, save horrible illnesses and conditions that can be avoided with just a little bit of knowledge. And the great thing about, I don't know if you remember in that video, they iterated that the organic products are more expensive. That is not going to be the case with Nspire. Okay, it's going to be very affordable. In fact, I heard somewhere, I don't know how many come in the pack, because that's kind of out of my league, but they're going to be around $5 a pack. I think that's kind of in line with what people are paying now. So it's not it can't be a lack of finances that's going to keep anybody from using these products. Now that they're there, they're affordable. There's no sense in anybody using a product that has the potentiality to make you ill. So again, get with your family, get with your friends, get with your relatives, and let's get the word out. You know, we need as many people as possible in this movement to let people know that there's an alternative there to the products that are on the market today.
Well, I'm so thrilled to hear that they're going to be affordable, Larry, because that was one of the things that I was kind of worried about. So I'm really glad to hear that. And I want to tell these ladies, and there'll be other people watching this video. I'll get it up on YouTube as soon as it's ready. I wasn't recording at the very beginning when I was introducing you, Larry, but from the minute you started speaking, I realized I didn't have it going. So I at least caught that. But I want to tell you ladies some of the things I saw in the other video that he shared with me. And it was, they showed how absorbent these things are. First of all, they're all organic. And they don't have any plastics or anything in them. So like he was talking earlier about the no air getting in there and the germs and stuff. And of course, as nurses, Leilani's a nurse here. And he has some health conditions that could very well be related to some of these products. And if she wants to come out and share some of that story with us, I'd be glad to have her do that. I know she's vocal about it because we are trying to teach women about some of these dangers. And there's also another very strange thing that might have caused her cancer as well, and maybe she'll mention that because we're actually trying to find some legal help. So if there's a lawyer out there when she talks, pay attention, and if you can help this lady, please do, because she needs some help from a lawyer. And she has a good case, I think. I used to actually work for a lawyer as a nurse on the side, helping him investigate cases from the medical standpoint. And looking at Leilani's case, I do feel she has a very strong case there. So anyway, back to what's at hand. These pads, they were smaller. I mean, lengthwise and stuff, they were about the same size as a regular pad, but they were a lot thinner. These are maxi-pads we're talking about. They were real thin. They were more like, look more like a little mini pad or something. The thin, you know, like a little, not, you wouldn't, it's not thick like a maxi pad. But the guy took a glass that had just water in it, you know, and he poured it on a regular maxi pad. He poured it on this one. And then he took a tissue and pushed down on it. And of course, all of us here know what happens on the regular one anyway. It was soaking wet because we know, you know, they don't pull the moisture away from you. But this Nspire one and I'm going to be carrying these two because I think it's important. I myself have had cervical, like as close to cervical cancer as you can get, enough to where they had to do surgery on my cervix. And then I've had fibroids and ovarian cysts, and I wound up having to have a total hysterectomy. And so I'm, you know, that's why I put on a soapbox about this, and I didn't plan to be in a product company, but when I heard about how important this is, I didn't have much choice as a nurse. So, and also another thing, that these hormonal fluctuations can cause miscarriages. And as a nurse, I had to deal with a lot of women in that aspect, and even had a miscarriage myself. And so this is very important that we get the word out about these things. But these pads, they're like super, super absorbent. When he put the tissue down on the other one, there was no wetness there at all. And they have this thing in them that kills odor. Like there's no odor. You know, normally when you use pads, that's why a lot of women use tampons, because they don't like the odor. Blood has a certain odor to it. And these pads, in the video, the guy gave them to his daughters and said, here, use these pads and tell me really honest what you think before I start representing this company. And that was one of the first things they noticed, is that there was no odor. So they're completely absorbent, dry, whisking the wetness away from you, and there's no odor, and there's no plastic to trap in the bacteria and stuff. And so, and really, we should not be using tampons. I know people, I know I always did, and I just didn't like the pads, but they're really finding out that they're not healthy for people, because if you think about it, things are supposed to be coming out, and you're just like plugging it up in there, and that's how we wind up with endometriosis and some of those other kind of things too, is by plugging stuff up. So it's just much healthier. I have 3 granddaughters. One of them is menstruating, so I want her to not be using all of these products that have all these cancerous components to them. And they also they have the glyphosate in them, which everybody's familiar with from the Roundup. They have the regular ones on the market, they're finding glyphosate in them, and that too causes cancer. So it has more than one cancer causing ingredients in there. And like Larry was saying, the dyes, a lot of them have come out with these dye strips, and it's supposed to tell you when to change the pad or something. I don't know, like somebody doesn't know when to change the pad, but but these dyes, they can be like absorbed up into our body too. And like Larry was saying, a lot of them are made from recycled newspaper, and they have chlorine and dyes in that as well, even though we don't see them with the naked eye. So I just can't believe they have gotten away with this. Like, I think there's going to be some really major, what do they call those lawsuits where there's like a lot of people involved, because this is just, they just, I don't know. Hey, Lonnie, would you like to come out and share some of your story with us, honey?
Hi there, Catherine. Oh, Lord, where do I even begin? You've hit my soapbox, too. Both of us being nurses and both being in the GYN and baby field of nursing for so long. For those that don't know me, I've been a nurse for 39 years. I'll be approaching 40 years of nursing in September of this year. And most of my nursing has been in postpartum and GYN, gynecological nursing. And to make a long story short, fast forward, in June of this past year, I had postmenopausal breakthrough bleeding. I had one-time instant, one episode, and I knew instantly that something was wrong. I had had a hysterectomy 13 years prior, and the reason for my hysterectomy was because I had fibroid tumors that had calcified. Prior to my pregnancy or my hysterectomy, I had endometriosis. I was put on fertility drugs, so I was on Clomid for 6 months because I had trouble getting pregnant, and that was from the endometriosis, also other hormone issues. I also had hyperthyroidism, and most people don't think that's correlated, but it really, your hormones affects everything when it comes to the female when you're trying to have birth or with any type of gynecological issues. So when I knew in June that that wasn't normal and right, I went to my doctor, and I had been 2 years since I had had a pap smear. And for those women who have had a hysterectomy, if you don't have a pap smear every year, you better start now, because cancer does show up after a hysterectomy. So anyway, I went to a doctor, had pap smear and a physical exam, and they found a mass. I went and seen an oncologist, gynecologist, did a biopsy, and it came back as having vaginal squamous cell carcinoma. I had surgery to remove that tumor. it was aggressive and it was not all gotten. And in the pathology report, 8 more tumors were found. I had a second surgery, ended up having a total vaginectomy. And with the pathology report from that, it had metastasized to the rectal wall, and I ended up with 8 weeks of radiation. I just had my scans for 8 weeks after my radiation this past week, and I'll know next week the results of that. But the point of the matter is, you know, and when Catherine, she come out to take care of me for 3 weeks, God love you, miss you and wish you were back here. We had done some research, and it went back to my time when I was getting pregnant. I was on Clomid and didn't know, and had found out then that my mother was given a drug. So it's very important, too, for you to know your family's history. What kind of medications or complications did your mother have with delivering her children? In my case, my mother was in preterm labor with me. They gave her a drug called diastebestrol, also known as DES. It carries 3 generations. It crosses the placenta, and the fetus becomes a carrier. At the time when I was trying to get pregnant, I didn't correlate all that together until I found out this summer that I had cancer. Started putting the pieces together, and with Catherine's help, we did research. And one of the side effects to this drug, diastebestrol, is vaginal cancer. So, back to the drawing board, and it was taken off the market in 1971. So there are probably more women as they reach menopausal age that may incur this. To my doctor's knowledge, I am the 3rd case in Nashville in 45 years to have this. So it's very rare, it's very aggressive, but I'm going to kick cancer's butt. Anything else, Catherine?
Yes, you are, darling. Thank you so much for sharing. And I just, you know, Leilani is such a trooper, and as nurses, I think we have, you know, that push through attitude, but such a blessing to, I got to spend 3 weeks with her down there in Nashville, and do some other kind of treatments that I do for people that nobody else does. So, but, you know, it's just really, it just makes me angry that they can use these things that have such effects on our bodies and not tell us about it. And I don't know, like being a nurse, there's such a thing that gets drilled into our head in nursing school, which is informed consent. And it just seems like there's no informed consent on any of this stuff. They should at least have to tell you if it's got some of these chemicals in it, sort of like the GMO argument. At least label it so that I have the choice whether to use it or not. I'm so thankful for this company called Nspire, who has seen this issue and come out with these new pads that are much better than anything on the market to begin with, as far as keeping you dry, less bacteria, no odor sort of thing, but also to just not put all of those chemicals and stuff in you, and at a good price. I'm just so thrilled, because I was like, oh no, they're going to be wonderful, but you know, be 8 times the price of what you could get at the store or something, like a lot of companies do. And I'm that tells me that this company is serious about really helping people. And that's important to me. So, Larry, I'm going to open it up for questions, if that's okay. Let me unmute you. And either one of you ladies, if you have a question, come on out and ask.
Well, Catherine, one thing that wasn't addressed with all this, you know, we're talking about cancer and all that, with tampons, there's also the toxic shock syndrome, where these young girls have kept these tampons in for 8, 10, 12, 16 hours a day. You know, look at the bacteria growth in that.
Absolutely. We didn't bring that out at all, but that's true. There's a lot of young girls and women that have lost their lives from that toxic shock syndrome, and it takes them quick too. I mean, it's a scary thing to deal with, and you would think when people started having that happen that they might have pulled them off the market or something. You know, I don't know what it takes to like get something taken off the market. Joyce, honey, did you have any questions? Let me unmute you. Hold on.
You can hear me?
I can hear you. Yes, ma'am.
I don't know where I went. I lost the picture. And all I did was turn a game off that makes noise.
Oh,
and,
that's okay.
And you disappeared. But that's all right. I listened.
Good. Well, we can hear you. Did you have any questions for Larry?
No, I could just share. I had a hysterectomy when I was 27.
Oh.
Because I had bled profusely for 6 months. And after 2 DNCs, and it still didn't stop, I had it done. But they left my ovaries in, and the cancer went to my kidney. I don't know how it made its way up there. No, I'm kidding. I mean, I did have kidney cancer, but it's all gone now.
Well, good for you.
I had a problem in that area, and I don't really talk that. The mesh, I just can't even comprehend at my age. How you put it in, what does it look like, how does it work? But nothing matters now for me, you know, but if I could help someone else, yeah. I should get knowledge.
Absolutely. And also, I'm positive that I've heard that this company is going to come out with diapers, which I still have grandbabies. I have a granddaughter menstruating, but I have grandbaby diapers too. And my daughter uses natural diapers. They don't have the chemicals and stuff in them, but they're super, super expensive. And I'm also hoping that the company will come out with some type of an incontinence product, which really these maxi-pads would work as an incontinence product because they're so absorbable. Because a lot of ladies, especially post-hysterectomy, have problems with leakage. And I would just say, because of the number of mesh injured women that I speak to, who are, their lives are horribly destroyed. I would rather see you continue to leak and use a product like this than to let them put the mesh in there to try to repair do the sling and try to stop you from leaking that way. It honestly do not. The doctors are saying, oh, it's only the old mesh that causes problems, not the new mesh. There's no old mesh, new mesh. They just changed the name.
I know.
It's criminal. They should be jailed. It's crazy. And so don't let them put the mesh in. And just, now that we know we have a safe product that we can use, we just use this. It's super absorbent. I saw the guy pour like almost 2 little glasses of water in there and then put it in the cup and let it soak it up, and he tipped the cup and like not even 1 drop of water came out of there. I was like, oh my God. It was really, I'll send you I'll find that video and send it to you girls in the private message so that you'll have it. You'll see what I'm talking about.
How do I get my voice gone?
I can mute you back out, honey. All right, you're muted out now.
What about adult diapers, Catherine? You have both men and women who are incontinent, both urinary and fecally, and they're in those diapers sometimes 2 or 3 days, depending on how incontinent they are.
Absolutely. I hope that they come out with a product like that. I myself was in adult diapers for quite a while there. I've been on both extremes because of my spinal cord damage. I've had total incontinence both ways, and then I've had to catheterize myself and do bowel program because I couldn't go. So I've been on both extremes. And those diapers are like, they make you sweat so badly because of that plastic. And you get like, if you don't do something to address that wetness, then you can get yeast issues from that. And it's just, oh my goodness. So I really hope that I don't know, if they come out with the baby diapers, I bet they do. It will drop it in their ear if nothing else.
Yeah, let's do that, Kat. Let's do that.
Yeah.
One thing I wanted to bring out that I read about this product is that it is ionized, and it's like from what
Say
I
that again, Larry. I missed it.
It's an ionized product.
Ionized. Okay.
And so what I understand is the way it works is, have you ever been out by a large body of water or in a forest where you're walking? You get a different feeling. And it's because the air is ionized with more oxygen. And it just makes you, I mean, especially if you've ever been around a waterfall. You ever been around, you know how relaxing you feel when you're around a waterfall or in the forest walking, because in the forest, the trees are giving off what? Oxygen. So, there's a ionizing property in these, and it's all natural. I'm telling you, this is gonna really revolutionize that industry. And again, ladies, get the word out. Tell everybody you know, especially those I don't want to say especially, but those people that are near and dear to you, females in your family. Please get the word out. And between Catherine and I, we'll both have information, and she can make my contact information available to you. We can help save a lot of people. So that's about all I have, Kat.
Well, and I especially want to address the teen population so that we can prevent all of these issues that those of us that are dealing with or have been dealing with. I had to have my hysterectomy because I just would not stop bleeding. And I got to the point where I had no iron, even inside my bone marrow. I had no iron. I had to go to a place that did chemotherapy and get iron infusions. And you have to go to a chemotherapy place because iron infusions cause anaphylactic reactions quite frequently. And so they have to have you in a place where they can handle that. And as sad as it is, chemotherapy places, they deal with a lot of codes there. I had a friend with breast cancer. I've had several friends with breast cancer. I had one friend who, she had the double mastectomy, and then they did chemotherapy with her, and every time they infused it, she died, and they had to bring her back. And I'm just wanting to rip my hair out of my head. Like, don't stop. Don't put anything in your body that makes you die. That's the first point. Just, don't do it. I don't care what they tell you. Like, there's so many other ways to treat cancer. But having said that, let's prevent it so that we don't have to treat it. So thank you so much, Larry, for bringing this information to me and making me aware of it. And I'm going to carry these products. I'll put them on my webpage. I think this company also has a couple of nutritional products or something. I don't know. This is what caught my eye, this product. And then looking forward to the diapers. Because we've got a 1-year-old, she'll probably be potty trained soon. She's so smart, but just so glad to to help people and know that it's going to be affordable too is so important. And Larry, I have to give you the high five, being a gentleman and speaking about these things that often women are not even comfortable speaking about. You know, we have such taboos in our society, and why we can't speak about menstruation, I don't know, but a lot of women can't speak about it, and a lot of men definitely never speak about it. So kudos to you for being a champion for women. And he's single, ladies, so he's a good guy. Thank you so much, Leilani and Joyce. We appreciate you being here. And Larry, is it okay if I put your contact information in the description of the video on YouTube when this is available?
Most certainly. And you know, I wanna thank you, ladies, for having me this evening and allowing me to pass along the little knowledge that I do have. And you know, put my contact information up there and give it to these ladies so they can pass it on to, you know, who they choose. And you know, let's help some people. That's the thing that I love. I love helping people. So let's help some people avoid some illnesses and make the world a healthier place.
Absolutely. That is absolutely what we need to do, because once you lose your health, it's so hard to get back. So let's prevent all of these things from happening. And we can, on another wellness, I'm not sure if it'll be next week or not, but we'll talk about some other things that can be contributing to hormonal disturbances, like some of the foods that we're eating these days. I think that would be a good topic as well. So thank you again, everybody, and we'll see you on next week's Weekly Wellness Zoom. Thank you so much, Larry. Bye-bye.
You're very welcome. Bye-bye.
Bye-bye.